All right. Thank you all for joining us. My name is Alex Oni-Edigin. Welcome to OFC College. Today is about awarding working in health and social care level 3, induction, and kind of giving you more track to doing the job. When we talk about working in care home, working in hospital, working in community, most especially in mental health hospitals and in PICU. PICU means Psychiatric Intensive Care Unit. I understand majority of people will be working international, they'll be doing international job, maybe Italy or Canada. This training, when we talk about United Kingdom accredited health and social care, I think is a high profile qualitative training. And the job we do in the UK kind of tally with Canada. I'm 100% sure Italy will also be providing the same health and social care when it comes to compassionate care, communication. When support worker, band 2 and band 3 had to work with doctor, nurses to assess, diagnose, and treat individuals who are having different kind of illness. So when we talk about health and social care, we're actually talking about a wide community. When we talk about really community like social care, council, we have social worker, we have schools, children's schools, we have GP, we have hospitals, we have clinics in the community, and we also have care home, nursing home. So these are areas that collaborate together. We also have clinical and not clinical profession. When we are talking about maybe those that do plumbing, cleaners, a majority of people that actually work around health and social care. It's not about one-sided organization. It's a multi-organization. I think actually there are over 500 workforce, over 500 workforce. Majority of the popular one we talk about health and social care, people talk about nurses, support worker. You know, when we talk about healthcare assistant, majority of people look at ambulance, healthcare assistant. So now when we look at healthcare assistant in the language, that's where you have really ambulance. So on the ambulance, you can have doctor there, you can have nurses there, you can have different kind of level of band of healthcare assistant in the doctor system. So if you go to A&E now, healthcare assistant can be those who actually support with clinical support, like they do phlebotomy activity. So phlebotomy are those who take blood. So they also remove all these, they fix cannula, they remove cannula. So all these things are different skills when we talk about hospital. But when you go to care home, healthcare assistants are just like support worker in the language. They also call them support worker in care home community. So, but in mental health, they have different skills there. However, they majorly call them support worker in mental health. So if you ask some people what kind of job you want to do, they say, I want to do support work, because they think support work, you doesn't help, doesn't do personal care, and it doesn't help people to go to toilet and all that. However, for me, I've been in care for over 10 years. I've done different level of care. I work in community. I've done different kind of practices. So I think the language support worker and healthcare assistant, they are the same when it comes to mental health organization. So we're also going to talk about working with those who do acute support. That might be a big language when we talk about emergency support, serious treatment. When we talk about those who are highly psychotic, when we talk about those who are doing different kind of diagnose, really, in different settings in health and social care. So again, when we look at this background now, health and social care go wide in different steps. It can also be people who is in their own home. There are a lot of people who want to do this job when we talk about, I can't remember the community job, live-in care. So the same approach, that's what it's all about. So now, when we come down a little bit, what are the role of health and social care? So let's focus on band 2 and band 3. That is support worker and healthcare assistant. The role of a support worker is to work in collaboration with multidisciplinary team, that's MDT, nurses, doctor, manager, and any other profession when it comes to occupational health, to promote assessments. People come to hospital or nursing home or mental health hospital, you assess them, then you diagnose them. At the same time, these are your support. At the same time, treat them. So the treatment part, that's where I would think support workers are majorly very important. Now, where we talk about feeding someone and bathing someone, encouraging someone to promote their independence, or using hoist, moving from someone from bed to wheelchair, from wheelchair to bed, or from bed to chair, or supporting someone to eat. These are the language I will say is holistic care. So now you kind of support someone from, let's use the word psychosocial. So now you're actually helping individual from their head. Does this person have headache? Can this person see? Can this person brush their teeth? Can this person see? You know, then from there, you're looking at the person's shoulder now. Can this person have maybe wear clothes? Can you support this person to wear their clothes, or you have to encourage them to wear their clothes? Or as the person eating, and you know, as the person had a bath, is it shower they require? So these are basic things that you do. At the same time, can this person walk, where you look at their mobility? So your role as a support worker also involves documentation. So documentation can also be you writing a care plan. It's not necessarily mean you have to create a care plan, but you are part of those who are writing notes about the patient. Obviously, whatever you've written down, nurse will take from there, doctor will take from there, whatever information you've put down. Say, for example, you were meant to go into number 4, James Street, Victoria Nursing Home. Now, you're going to Victoria Nursing Home as a support worker. You might be going there through agency. Agency send you there. You knock at the door and open the door, and you introduce yourself. I'm Alex. I'm a support worker. I was sent from maybe Alex agency, Osa First Care agency, to come and work here. They say, oh, they're welcome. Come in. Sit there. That's the staff office. Wait for the handover. So you're going to see up to about 10 staff or 8 staff. Those staff is not necessarily going to be the same kind of staff. That's where you see MDT sitting down now. You're going to have, maybe you might have managers sitting with you at the same time. In some homes, you might also have patients sitting with you during the handover, depending on the care home. And you might also have a nurse there. You might have senior carer. Senior carer are mostly band 3 or band 4. So you might also have occupational therapy there. So now, this is where they're going to talk about Mary. Mary had a good night, or Mary didn't have a good night, or Mary sleep well. So now all this information has been documented. The same thing you are going to do to give the handover. If you are senior carer, Moving from the next step, you also have, when we talk about those who are having to diagnose now, they have issue. Your role is also, there are some homes, I don't know who have done care job before, they might ask you to do like one-to-one with patient, eyesight. That's where you majorly engage in observation, to observe that patient. Doing eyesight, let me say eyesight, let's forget about eyesight. Let's talk about general observation. If you are with patient in the room doing observation, you also need to think psychosocial. Again, you must think psychosocial when you are doing observation. If you are doing lone work in community, doing living care, you also need to think psychosocial. Has this patient eaten? Have they had a bath? If they are sleeping, you monitor their breathing. So you need to be able to also have the skills when we talk about news observation. News observation. News observation. Is my internet okay? Can everyone hear me?
Yeah.
It was cracking a bit a while ago, but it's okay now.
All right. So
it's fine now.
Sometimes the recording is great anyway. Yes. So we also have what we call news observation. News observation is national early warning sign. So most of the time, I always call national early warning score, because you have different triage that you have to score, 1, 2, 3, as a support worker. Once it's more than 2, or if it's even 2, you need to report to nurse. So now, news observation is where you need to learn how to use blood pressure. You need to learn how to use oximeter. You need to know how to use what is it called? Thermostat. Is it thermostat? The temperature thermometer. The temperature thermometer. Yeah, thank you very much, Mark. Thermometer. So these are basic skills that is not massive to me compared to when we talk about being professional as a nurse. But although support worker, you still need to be professional, really. When we talk about time management, when we talk about reports, when we talk about mandatory training. So again, your role as a support worker also involves mandatory training. Some organization mandatory training is about 20. I think NHS one is 22. So when we talk about health and safety, infection control, first aid, and different steps of mandatory training before you start working. If you haven't done any mandatory training, I advise you, do not go and work. If anything happened to your patient, you are responsible. Your colleague will be happy if you haven't done any mandatory training, because they can go to court and say you don't have any skills, you don't know anything. Even if you hold a first-class diploma in care, or you hold a first-class NMC, whatever, you don't have mandatory training. It's required that you're not competent in your job, or you're not serious, you know. Mandatory training is very important. We also offer that mandatory training. If you've done this course online, not on Zoom, if you've done the e-learning, we can issue you the 15 to 18 mandatory training certificates free. If you've done it on our platform, because there are some of the units that cover care certificate. So care certificate is 15 standard. And if you cover that 15 standard, I tell you, you're going to be a star in doing health and social care work. You're going to be a star, because that covers lots of mandatory courses that will give you more details in terms of looking after people in health and social care. So now, when we talk about healthcare assistant, we're also talking about you having to have the skills to provide clinical practice. Clinical practice. So clinical practice is part of everything I've been saying. The difference is that you are more thinking, more awareness, more conscious of being clinical team member, clinical staff worker. When we talk about understanding the news observation, understanding 6Cs. So now, I'm going to share a message. If you're on our page, union page, I'm going to share a message there when we finish. I will share before we finish anyway, so that you will see a video of 6C. You can also visit our website, ofctrainingcollege.co.uk. You click on news. When you click on news, I think 6C is the latest news there. So you just read everything. You will enjoy it. So 6C alone, with 6C, you can pass interview, any interview, even any, what's it called, nursing interview. You can pass nursing interview. You can have attended, but I don't know. I'm very good at going for every interview. I'll just sign up for the job. I'll go for that interview. So I've attended about 3 or 4 healthcare assistant interviews about 3-4 weeks ago. And they were actually asking their question from 6C. I was shocked. So we are asking their question from 6C, talking about safeguarding, talking about if you want to work in Meta, they ask you about Section 17. They ask you about loan work. They ask you about loan work. They also ask you about, I think, safeguarding, really. All their questions are based on safeguarding, which is very important. You study that. So now, when we talk about clinical practice in hospital is not different from mental health. The only difference between mental health is that they're dealing with people that you actually judge that they have mental health problem. That's the only difference. Because we judge them that these guys, oh, they're violent, they're aggressive. That's the difference. But if you are in A&E, I think A&E is more difficult to work than mental health hospital. Because A&E, you see unlimited kinds of people. There's nothing like you're going to see only black people, only white people, only green people, only yellow people. You're going to see different kinds of illness coming in through that door, coming to you. But in mental health, they've actually screened them. They've given them many, many assessments that before they present it to you, you know, let's talk about the most difficult mental health, maybe forensic. You're going to have someone coming from police station, they will handcuff the person. And the person is calm. Then from that handcuff, you're going to have about 6-7 staff, according to NAPIQ. 6-7 staff taking the person to seclusion. Then from seclusion, the person goes to calm room. From calm room, the person comes onto the ward. That's where you can actually see the person really, you know. So now, you find out that there are many processes they've actually calmed this person down. But in A&E, there's nothing like that. The person can just walk in and be aggressive. You know, before the police come, it might take 5-10 minutes, you know. So it's very important. But when you have your mandatory training, you have your mental health awareness training, it's very important that you will be alert at your workplace when it comes to loan work. You know what is data protection. You know what is safeguarding adults and children. Even if you are working with adults, you still need to do children because some of the adults you are working with, they have children, really. And if you're working with children, you still need to do adults because some of the children you're working with, they also have parents. So if you might be in nursery now, a dad or mom coming to drop off their children, you can see signs of abuse on their mother. So you'll be able to notice signs of abuse on their mother, or you'll be able to notice signs of frustration on their dad, you know? So safeguarding course will teach you all these things. And so please, when you also want to do this job, when it comes to health and social care, you need to have mental health awareness. Mental health awareness. So we have more details on our website when we talk about mental health awareness. We have up to 20 maybe 25 mental health awareness. So also through Mind, you can get more details on mental health awareness, mind.co.uk or mind.com, I think. And if you know about depression, schizophrenia, schizoaffective disorder, bipolar, or you know about schizophrenia, schizoaffective disorder. I don't know if I said it right. Schizoaffective disorder. Yeah, I said it right now. So schizoaffective disorder is just having the same symptoms. It's like what we're talking about MDT, many staff, many professions. So schizoaffective disorder is having schizophrenia, is also having bipolar symptoms, is having depression symptoms, is also having like multiple symptoms. It changes every day. So you can't really predict your patient that is schizoaffective disorder, you know, but you can predict, so this person is having depression. Maybe the person lost family, or they lost their job, or they don't have money, or, you know, you can actually look at that as one approach when we talk about depression. So just have awareness of mental health awareness. And also some medication. When you are doing one-to-one in mental health hospital, two things you need to focus on. If this patient is high or low. If patient is high, although they're going to put that patient on high risk, but to me, look at that patient as easy patient to work with. But the patient that is low is more dangerous, because you will think this person is okay. You know, it's just like we all are here now. You can see me talking, maybe I'm very okay. You know, this guy is okay, just talking out. Look, he's very sound. It's not like that. Something can be wrong. So if someone is more quiet, that's the most dangerous part of it. So if your patient is very quiet and is in their room, that patient, check their history. They can commit suicide anytime. So it's always very important. If you're in hospital, you are with a patient with depression, monitor them at all times. Engage them with activity. If they are sleeping, they are on hourly observation, make sure you check them that they are breathing. Don't write your note that appear to be sleeping. Appear to be sleeping. You're not going to get down for it, because the judge will say you said appear. So someone who is actually there can actually appear to be sleeping, isn't it? So, but I will beg of you, make sure you put sleeping and breathing, because you have checked. But if you haven't checked, be careful. What you put down, they can be used against you in court. So it's very important that you have clinical practice awareness in mental health hospital. I will send a video of full mental health on our page as well. So you can see different kind of mental health, and also two kinds of medication when we talk about clozapine and lithium. I don't know if I pronounced that one well, lithium, clozapine and lithium. So if a nurse is giving patient this kind of two medication, they are highly risk medication that patient need to be monitored. You cannot go and work in hospital or care home. You do not have knowledge of side effect of this medication. But once they put you on one-to-one with a patient, you are with that patient for 1 hour. So if they also put this patient in seclusion, where you look at this patient from CCTV or camera, where you have to sit down, make sure you didn't fall asleep. Make sure you eat very well before you leave your house. Make sure you document every 15 minutes of that patient activity. If it's 10 minutes, is okay. And make sure the patient is breathing. Now, to check breathing, you have to make sure you can't, is it respiration? Respiration. You can't, the person breathing for 60, is it 60 seconds? Yeah. But you need to have a number between 12 to 20, I think, 12 to 20. I'm not 100%, I think it's 12 to 20, or 12 to 21, 12 to 20 or 12 to 21. You can't, one, that's 1, 2, And if you can't see the patient, call the nurse in charge. Say, sorry, I can't see the patient. I can't count the respiration. I can't see the breathing. Don't create numbers that you can't, you put 13 or you put 15 or you put 18 every hour, please. Always make sure you check this patient out. Again, when we talk about level 3 in health and social care, generally you need to have awareness of what is health and social care. We've already talked about that now. We talk about different settings in health and social care, what make up health and social care. So as a band 2, band 3, you can work in GP, you can work in hospital, you can work in community, you can work in children schools. Nursery school is counted as health and social care, a care environment. So you can also work there. And you also need to understand when we talk about managing news observation. So news observation, the only way you can support with people who are curing premature illness to avoid premature death is having full awareness of different triage of news. When we take score 1, score 2, score 3. So if your patient is not breathing, and if you do blood pressure, you do respiration, you check their oxygen level, you'll be able to report to the nurse in charge. The same thing with mental health patient. So depending on the setting you want to work. Do we have any question?
Oh, no.
No question for now.
Oh, thank you, sir. Sir Ali, do you have question?
No, sir.
Sir, is it Obi-Wan?
No, that's not my name, sir. I'm AGK Hamibe Jeffrey. We're no questions for now, sir. It's clear.
Great. I thought now I have more energy hearing you talk. I keep calling you Obi-Wan. It's on your screen. Sorry. I'm really happy you talk. So finally, let's focus on mental health hospitals now. So when we talk about mental health hospital, you have different kind of mental health hospital. There are hospitals where you have I don't know how to describe it. Okay, we have Signet, we have Priory, we have a different NHS trust. So now we can support you to register with NHS if you have right to work in the UK. That's free. We support you to get the application form online. So now you need to make sure you are able to understand 5 mental health awareness. 5 mental health. I just listed 4 for you now, which they are kind of true schizoaffective disorder. You can list about 3 or 4, isn't it? So it's very important you have that education of mental health awareness. So when we talk about mental health awareness, the first thing that comes to my mind, how someone who is physically and mentally, and someone who cannot do their daily activity as normal human being will do. Say, for example, someone who cannot locate bus stop, or someone who is by the bus stop and aggressive by the bus stop, or a driver who is not patient on the road, very aggressive driver, or someone who cannot remember their appointments, or someone who cannot stop thinking about their loved ones that they lost, or someone who cannot actually They can do everything, but they can't make friends. They like living on their own. And at the end of the day, they end up not going to work. They have job, but they can't go to work because they don't like staying with people. You know? So there are different ways to look at mental health. We should stop looking at mental health like something to do with something that we don't want to see. Some people said the patient is lying. You know, patient is lying. That language, we should stop using it in mental health environment, or someone is pretending. You know, someone is thinking about their lost person, which can be classified as depression. Some of them you can classify as PTSD, post-traumatic stress disorder. Maybe majority of people who are diagnosed with post-traumatic stress disorder can be someone who went through different trauma in the past, ex-army. An ex-army, there's possibility that they have post-traumatic stress disorder. It's called past stress disorder. You know, again, schizophrenia can be someone who doesn't know how to manage their drug intake. They overtake the drug, they overtake the medicine, or they have issue with alcohol. And lots of things you can see really. Even some people are in mental health hospital because of some of the medication they've actually take from approved doctors. Yes. People can be in hospital because of that medication. So these are part of drug abuse, drug misuse that actually can lead people into mental health hospital. So we should have, as a support worker, when we talk about having level 3 health and social care, you should be able to have confidence to be able to prove that you have compassionate attitude, compassionate skills, compassionate support for every individual, not just for your patient, but for staff. If you are doing personal care, you have the chance to check your patients if they're depressed, if they have injury, or if you are doing admission, check if this person has been abused from home. If you walk in here and you will see lots of abuse, people having injury that they hide in their body for a long time. So when they get to A&E, there's what they call triage. If you walk in triage, the assessments in triage involve not just they do your news observation, they will also do your body map. That will lead to you taking off all your clothes or part of your clothes for them to be able to assess you if you have any injury. It's just like you taking a car to garage. They want to check everything, they diagnose it. So that's what A&E is very good at. So if you take someone to normal care home, there's possibility and they might not be able to see it in 48 hours. However, in A&E, they will see everything. And they can report that into police immediately. So as a support worker, those are part of your job, reporting safeguarding and also protecting patient privacy. So now, in mental health setting now, we also have what we call psychiatrists. The role of psychiatric is also very important. As a support worker, even if you have first class in mental health awareness, you shouldn't, the education really is about you to have that insight of the symptoms. So when this thing is wrong, you can report to the nurse or document it so that the doctor can see later. You do not have the right to address any human being that they are mentally unwell. You do not have the right. You can do it on your own if you're with your friends, but when you are working as a staff member in any setting, you do not have that right. We tend to overlook it. Sometimes we can be telling our staff in the office, discussing maybe some jargons or different language. That is not allowed. you better just not involve in that conversation, because once the patient heard you saying they have schizophrenia, you have to explain when they had it, who gave them. It's only the doctor had the right to diagnose, psychiatrists have the right to diagnose patients that they are so and so, they have bipolar, and that should be written on their book. So if they ask you, if you don't have confidence to say it, refer them back to the nurse in charge, to the registered mental health in charge. Say, the nurse will come and have one-to-one with you, and my role is just to support you, to make sure you are independent. If you need anything, do you need to go to the bathroom? Do you need a wash? Do you need your food? And do you want me to communicate any information to the nurse or doctor? I'm just here to observe you to make sure you are fine, because you are in a hospital and the doctor said you are aware. I don't know if that makes sense. You are in hospital, the doctor said you are aware. So I'm not quite sure what you have, but the doctor said you are aware. So some patients can actually tell you what they have. So your role is to support them with their independent, their day-to-day activity, to bring them back to their normal need, really. So now, we're going to start interacting now. I don't know if I can start with Susan. If you can, I don't know if you can tell us anything you understand about health and social care, or maybe if you've done anything in the past.
Yeah, health and social care, coming from the angle of a support worker, is knowing the basic about how to take care of people with challenges. It could be community, it could be residential, it could be a hospital, and other places that are applicable to, the work. In health and social care, you are expected to have the mandatory training, which includes safeguarding, first aid, and so on and so forth. You've mentioned that there are so many. Some people are 5 by 18, some 11, some 30 something, and so on and so forth. And the basic work you do is to assist them, assist the nurses and the doctors. The doctors are to, especially when it comes to hospital, the doctors are the main people who diagnose, who treat. Yours is just to assist in taking care of the people, as in to support them either through personal care, assisting them to do one thing or the other, which they can't do. You've also talked about those in that are having mental health issues. We've talked about schizophrenia. You talked about those with bipolar. You talked about those that are going through depression, and you say some can actually have the 3-in-1. You said the schizo
Affective
something
disorder.
syndrome. Yeah, something syndrome. I can't remember the middle.
Yes, schizoaffective disorder.
Yeah. Then you've also said we should be very careful when we are working in a mental home. We should be careful of those that are very low, because they are prone, they can commit suicide anytime. And if you are in a place like that, you have to be careful, especially in taking care of them. If you're probably on one-to-one with them, you have to take details of everything that goes on with the patient, some 10 minutes, 15 minutes, and you have to be awake. You have to be very sure of what you are recording. And as a health and social support staff, you must record everything in detail. And there are so many other things.
Wow,
I think
wow,
basically this is what I'm able to just remember at the moment. But I've gotten a lot from you about the medication and so many other things, which there's one basic thing I've learned today from this program, from this Zoom meeting, is that when you don't discuss what a patient has, you don't know about it as a support staff. It's the duty of the doctor to tell the patient what the problem is, because I think I have made that mistake once, because where I work is we support those that are coming out of mental issues. Some are going through depression, schizophrenia, and so many other, where we have to administer clozapine. I do administration of medication. So I took a particular one to I think college, because we're thinking of fixing him up in a college. And they asked me what are what the issues are. And I told them the guy has a schizophrenia, and he has not been diagnosed of autism, which is in the process. So I've just learned tonight that it is not in my place to tell them what the problem is. I should have referred them either back to the home or to the doctor. So, and I want to say thank you so much for that, sir.
Yeah, thank you for sharing. Thank you. Wow. Wow, thank you. And I was hoping everybody's going to take that time you just took. I don't know. Sir Ali, do you want to say something?
Well, I can contribute, not that much.
Thank you.
What I've learned here today, because it's my first time, is that being a social healthcare, no? Your duty is to take care of the, let's say, children, the vulnerable, old, those who need support, and then those who are mentally challenging, that's who have some challenges in the mental health side. And then being a support worker, your duty is also to help them, to have a one-on-one contact with them, assess them, whether they are fit to do something, that is, whether they can see, if they cannot see, whether they can hear, if they can't hear, if they can smell, and then coming to their shoulders and then down to, that's from head to toe, the help that they will need if you are there to assist, and the percentage at which you have to assist them. That is one part of it. And also their medication side. Well, and then taking notes also about their condition, and that's doing a physical check, not writing what you think. You have to visit them, imagine, don't think, and you have to feel it. That is doing some physical checks and then putting it down. And also to keep their privacy, that's their secrets. You don't have to put it out, and you don't have to also determine what they have, because you are not there for that. You have to inform your superior, either the nurse or the doctor. They have to judge or decide on what the patient is having.
Definitely.
Yeah, I think that's the little I can say here.
Thank you very much, sir. I'm really pleased for that. Thank you. I don't know if anybody else want to contribute, or do we have anyone else?
Okay. Thank you, sir. I appreciate so much what you have opened us up to this evening. Yeah, one thing that I'm taking away from here also is that even if one is trained in the aspect of taking care of probably children, one should have an understanding of how to engage adults also, because those children may have family members that are adults, so you should know how to engage them. And if you are trained in terms of handling adults, you should have an idea about also how to engage children, because then the adults that you are taking care of may have children within the house or wherever you are going to, to support them. So you should have an understanding of that. So this is one area that I have not really looked at before. So coming from you this evening now is something that I know that I have to take more seriously. Then also the area of having to carry out checks and making sure that one does a proper documentation. Yes, I do documentation, but the way you have said it now, I think I'll take it more seriously. Be sure of what I'm writing down. The positive of it that, yes, I saw it, and this is what I'm putting down. It's not a case of, okay, I just put the record there with the normal things, the normal routine. He goes through that or she goes through that. I just write it down. No. But rather, it should be something that I saw physically or that I was able to handle physically. Yes, I've taken the records and I saw it, then I put it down. Then I can defend it anywhere that, yes, I saw this and that is exactly what I wrote down. Mm-hmm. Just in event that something comes up and I have to defend that, which is something that I'm taking away from here this evening.
Thank you very much. Thank you. I'm just want to say something about Section 17. When it comes to documentation, Section 17 is where you take a patient out on leave. They have the right to go out from the hospital. So now this Section 17 can also be escorted or unescorted. So sometimes psychiatric will put something down on paper. They will not come to your office and explain it to you. They will never, majority of staff might not give this handover when you are doing handover time. So if a patient said, I want to go on leave, I want to go down the shop and buy something, it's your duty to go and check if this patient have the right to leave the hospital. Also, if this patient needs someone to go with them. At the same time, when this patient is going, you need to find out as you're talking to this patient, make sure you have conversation with this patient. If you are the one taking this patient, say for example, I'm telling you now, I want to go to the shop, Sainsbury's, to go and buy biscuits. You should be able to ask me, oh, is it just biscuits? You are not trying to interrogate me, but you are trying to see if I can talk to you, if I can have conversation with you, if I'm patient enough, if I can. What that is that you don't want to take someone to Sainsbury's and the person is aggressive to another person there, or the person is trying to pay now. Maybe the staff is saying how much stuff you've got there, bring this money, and the patient is not patient, is aggressive, is not having normal conversation with somebody. If that patient is shouting on you, why are you asking me? Make sure you go and steady enough. I just asked simple question. He shouted at me. I'm not comfortable taking this patient to the shop to buy something. Also, make sure you know what this patient is wearing. You document it, and because there's a space there, they will ask where to. They will also ask description. Put everything down what this patient is wearing. The color, don't guess. Make sure you see this patient before you write it, because the patient has to also sign. Then you now take it to registered nurse who is in charge of that duty. They will sign before you take this patient out. Otherwise, there are some people who have issue of, let me say schizophrenia really, so that we can play around some diagnosis. So majority of people with schizophrenia can have some delusional or some psychotic thinking, some feeling, or they can just say, okay, their mom is their enemy now, or their mom is the one that wants to kill them, or one of their cousin or their friend. They can have that in their head. So now, if someone like that is having such thing in their head, can be in their bedroom, then he comes and says, I want to go and leave. You will not know this thing is there. They can actually leave the hospital and go and kill somebody. Or some of them can also be vulnerable. Someone must have given them drug that make them start having schizophrenic issue or whatever, that mental health issue. And they come to us, so they've been looking for them. You need to also be careful that the person you are taking out, you monitor what they are going to wear, whatever. So when the person comes out, run on the bus, maybe they want to go and deliver drug, go and take drug, you'll be able to call the police, say, this person is wearing this. This is the number of the bus. This is where this patient is going. These are basic things that we can actually not talk about in the real life, but because I cannot actually talk about this now, why I'm talking about this on this platform, because I'm under OFC College. This is like an educational platform. Well, you can't really have this conversation when you are at work, isn't it? Your staff cannot tell you what is happening. Majority of people will tell you about diagnosis. You won't even know what is mental health. You're just working there. You're just going to dementia. We can hear dementia. Your brain will even go into what this illness is about. So now, people can have that view. They can also have the view of you as an individual. They try to harm you. Okay, let's go out. When I go out, I'll beat up this guy. So then, when you're having this conversation, you will know this patient, is they wake up early? Have they had their medication before we go out? I need to speak to the nurse. I'm not just going to sign it, give to a different nurse who didn't do medication so that we go out, you know? Or I don't talk to my colleague. Even if you have misunderstanding with your colleague, when it comes to being professional, there's no enemy at work. Especially mental health. You must talk to that person. Say, hey, Mr. Man, we don't speak the same language, but this is the language of this work. This is that, you know. And if you are going home, please, what I do when I get to work, I do every work. Whatever I'm saying that they are authentic. I'm up to date with health and social care. Once I get to work, I will take my phone, remove the location, remove my Bluetooth. Sometimes turn my phone off. I put in my car boot. I just go to work and go into the office, you know. I don't touch my phone until when I'm going, I turn it on. Sometimes I take like 20 minutes after the car park. People always say, Alex, I don't like following Alex. Alex spend like 10, 20 minutes in his car before he drives off. Because I'm turning on my phone just to check if there's an emergency, where I need to go or what I need to do, you know? So now, it's very important we get used to this. If we are at work, we are at work. If you are home, you are at home. Do not talk to your children. Do not talk to your wife. Do not talk to your husband. Do not talk to your neighbor about your job. Don't discuss it. You don't want me to tell anybody what is wrong with you. So why are you going to do that about your patient? You know, this is privacy. It's privacy. Before, years ago, we used to look at someone being aware, someone who is in hospital or who's in mental health is someone that doesn't really need in society. But when we talk about Mental Health Act 1983, this was updated in 2007. We do not have that right to be against them. The rights of assessment, diagnose and treatment, and safeguarding, compassionate care, they have it under that law. So that is our job role, to offer it to them. From band 2, 3, 4, 5, to whatever position you're going to say. Are you a cleaner? Are you a plumber? I don't know whatever position you're going to talk about. That is our role, you know. I will say that is the end of this induction. Now, I want to beg of you, if you are here and you haven't registered on the link I sent you, please complete that form. So what's going to happen is that we're going to use that form to create a recruitment profile for you. So they're going to contact you to do your full registration so that if you have right to work, they can send you to go and work. You will be contacted. OFC partners with over 15 recruitment organizations. Some of our organizations are care visa organizations. Let me just quickly say that. So if you are the person that doesn't have right to work, try as much as possible. Always save. Don't keep it to the last end. A lot of people, their visa run out. They start asking, Alex, I need help. I need da. Me, myself, I need help more than everybody. Just that is part of my job I'm doing. But the fact is that always talk on time. We can keep your privacy if if we can't do it. We are not going to tell anyone who you are, what's happening. But it's a shame if I can't help you when your paper run out. Because Home Office will ask you to go to your country, isn't it? I don't know. That there's something they say, which I'm not very comfortable saying it. Also, if a care organization fake themselves as care worker visa, it's easy to know. Get that name, go to UK Border Agency website. They have unlimited list of people they have approved to provide care worker visa. So don't fool yourself to pay lots of money. Do not pay for recruitment. Do not pay for recruitment. It's not fair. You paying 10, 15,000 pounds for recruitment, and your rent for a year is about 7,000, 8,000 pounds. You need to feed yourself as well. You need to feed families, isn't it? So if you have paid for recruitment and you don't have shift, come to us. We can support you to get different agency. We can ask you, advise you, but we don't want you to measure agency them because we are not police. We are not doing that. We know a lot of people create business to do whatever. Some of them have their policy. It's just that when we are coming from international, we don't understand what they call 0-hour employer. So some of them will win you because they have 0-hour employer policy. If you go back to them, they will tell you we don't have shifts now. That's what we said. They're not going to tell you they don't have contracts. They said they don't have shifts. So please always check, read your paper before you sign it. Court can always go back to your paper for 24 years or 25 years in mental health. I think so. If you work in mental health. So they can go back to whatever you've written and they can invite you to court if anything happened to your patient. Thank you all for coming. Again, thank you for supporting the Osa First Care community.
Thank you, sir. Thank you
Thank
so
you very
much, sir.
much.
Yeah, sir, please, I don't know if I can quickly ask a question.
Of course.
Yeah,
You want me to turn off the recording?
Yeah, okay. Anyone, it's still part of what we are doing, sir.
Let me turn off the recording so it won't.
Okay. All right, sir.